My name is Dr. Holtzhausen. I'm responsible for concussion care at Aspetar Hospital. Today I want to share with you a few thoughts on concussion management, specifically pertaining to the recognition of suspected concussion in the heat of the moment, and then the removal of a concussed player from the field, where it is particularly difficult, especially in elite level sport, in important final matches such as we see regularly. Concussion occurs after a direct blow to the head or when there is sudden deceleration of the head, which causes the brain to collide with the inside of the skull, causing an injury of the brain. It can be difficult to recognize suspected concussion in the heat of the moment because symptoms can be very varied and can also be very subtle. Where there are obvious physical symptoms such as a severe headache, nausea, vomiting, loss of consciousness, or even loss of memory, it is much easier and the player might even come and ask for medical help. On the other hand, there are much more subtle symptoms such as very subtle balance disturbances or just a little bit of slowness or general clumsiness, or visual disturbances such as visual spatial disorientation, which can be very hard to recognize. Athletes are inherently competitive people, and they would invariably shrug off or disregard subtle symptoms such as this. However, it is very important to realize that very subtle neurological changes can make a very big difference in performance, especially at the elite level, where subtle changes in performance can often mean the difference between winning and losing. So what is the solution to this difficult problem? It all starts with education at different levels. First of all, at executive level, where the policymakers and decision makers in sport must understand what the medical and also the sport effects of concussion can be. And then there should be education at operational level for coaches and referees. Any manager or coach has the right to know that his star player may not be able to perform at his best when he is concussed. And then obviously the players also need to be educated. And after good education, then a contingency plan should be made on how to manage suspected concussion in any given sport. Sports such as rugby are leading the way in this, where they are making extensive use of video coverage and video observation, independent match day doctors, and also a temporary replacement for concussion evaluations. In conclusion, it is important for all stakeholders to know that the inability of a concussed player to perform at his very, very best can mean the difference between winning and losing, and can change the history of competition. Here at Aspetar, we go to a lot of trouble to educate as wide as possible, very often through workshops, and we also provide guidance and support for doctors and clubs who need advice on concussion management.